Hi everyone, and welcome to my presentation on dexamethasone use in the NICU. This presentation will be a summary of my coursework in Nursing 610. Dexamethasone is used in premature neonates to aid in extubation and prevent the progression of bronchopulmonary dysplasia. Significant advancements in neonatal care have pushed viability to 22 and 23 weeks gestation. NICU teams are now faced with caring for these extremely premature neonates to give them the best chance of survival and quality of life. Dexamethasone use comes with many risks and benefits. Short-term benefits include decreased lung inflammation, which can aid in extubation and prevent further lung damage, since lung damage itself is a risk factor for adverse neurodevelopmental outcomes. While short-term risks include an increased chance of infection, necrotizing enterocolitis, and hyperglycemia. Long-term risks and benefits are harder to determine, as inadequate follow-up has been done, though some long-term risks include cerebral palsy and adverse neurodevelopmental outcomes. When a neonate is a candidate for dexamethasone therapy, the neonatologist and family must discuss these risks and benefits to determine if treatment is appropriate for their infant. This puts a significant decision-making burden on parents, as more research is needed to create evidence-based guidelines. This problem led to the development of a PICO question. I used the PICO framework by health evidence to define my target population, determine the intervention, define a comparison group, and outline the outcome. This led to the question: do premature neonates in the NICU with chronic lung disease or bronchopulmonary dysplasia have better post-discharge outcomes when treated with a late, low-dose dexamethasone regimen than neonates who did not receive any corticosteroid therapy? The next step in this process was to search the literature. The databases used in the search included PubMed, CINAHL, Google Scholar, and the Cochrane Library. Of the 11 articles found, the 5 chosen to be critically evaluated included 2 systematic reviews, 2 cohort studies, and 1 randomized control trial. One limitation presented was the lack of randomized controlled trials and lack of studies that included long-term follow-up. The next step was to critically appraise each article using the CASP checklists to evaluate the validity and applicability of each article. The evidence evaluated and appraised does not support that neonates with BPD have better post-discharge outcomes when treated with dexamethasone. However, the Canadian Pediatric Society recommends that neonates at highest risk of developing severe PPD may still benefit from treatment. It is evident that more RCTs need to be done to evaluate short-term benefits and long-term outcomes. The intervention chosen for this population was a patient decision aid. PDAs are a shared decision-making tool aimed to prepare patients to make educated and informed decisions in conjunction with their healthcare providers. Patient decision aids are useful when the treatment is an option rather than a standard of care. This includes the decision to treat with dexamethasone, as treatment is based on each neonate situation, comorbidities, and risk factors for developing BPD, while weighing potential long-term benefits and risks. This puts the decision-making on parents, who often have limited knowledge of dexamethasone use in the NICU, and neonatologists who have varying views on its use. A systematic review by Stacy in 2017 showed that PDAs increase patients' knowledge, accuracy of risk perceptions, decreased decisional conflict, and decreased indecision regarding personal values. Patients who used PDAs felt more knowledgeable, better informed, clear about their values, while playing a more active role in decision-making. Input from parents, neonatologists, and the healthcare team will be needed to create and implement an effective PDA in the NICU setting. The goal of the PDA would be to help parents navigate the difficult process of making challenging decisions regarding the care of their baby. I would like to thank everyone for their discussion and input this semester, and I look forward to answering your questions. Thank you, and I hope you enjoyed this presentation.